So, to educate us about the topic of travel with IBD, I'm delighted to introduce my incredible and wonderful partner in crime, Ms. Teresa Wachs, who is our lead nurse at the IBD Center at Seattle Children's. Teresa is, I would probably say she's the best thing that ever happened to my career, and I'm so lucky to work with her. So.
Well, I'm lucky because I get the most fun topic of the day. I always tell my kids, I got this from a movie some time ago with Denzel Washington, that you do what you have to do so you can do what you want to do. So that's what I tell my kids about, taking their medications and doing all this stuff, is you do that so you can do all the things that you want to do in your life. So to start out, two fabulous pictures of kids that did exactly that, took their medications, and long hair on, this side, she's in Egypt, and on that side, she's doing a semester at sea in the South Pacific on her Humira. I have no disclosures. So the relapse or flare of the disease due to the changes in dietary habits, forgetting to take your medications, or the unavailability of the medication where you're going, and infection is one of the big risks of travel with IBD. And some of those can be risks for any of us traveling. Acquiring infectious diseases that are more prevalent in developing countries, these can result in severe infections, especially in patients who are immunocompromised. So I'll talk about this again later, but patients don't know what they don't know. And they may not think to ask you anything I should do special because I'm, traveling to India with my family. So try to remember to bring this up intimately during their appointments. Ask them, what are your plans for the summer? And find out a little bit about what their plans are and what guidance you might be able to give them. Take an adequate supply of medication. Take the original containers, and then you can take your pill container and place them there when you get to Cabo for your months-long vacation. And keep them in your carry-on. We recently had a patient who ended up in Reykjavik and had no medications because they put it in their checked luggage. So that can be problematic. And keep hydrated. And water is what we want our patients to hydrate. If they're going to Germany, hydrating with beer is not the best. It's not the best idea for their IBD. Coffee and tea, maybe made with the local water, may not be as safe for them. So drink water and use bottled water unless you're traveling, within the United States or, a resort in a developed country, then you're pretty safe. Like it was mentioned earlier that both some of the medications and also the disease itself can make people more prone to sunburn. So remind them to use their sunscreen, probably at least SPF 30, probably higher if they're going to the tropics. Make sure they have medical coverage. Most state plans will not cover anything outside the state of Washington. Our patients that want to go to school in Montana or Idaho or California, and they have one of the state insurance plans, they are not going to be able to get their infusions there or get any medical care there. Medicare will also not cover out of the country. So you may think I'm feeling well, but even the healthiest person, can trip on you could trip right there like I did, and end up needing a medical evacuation or needing treatment, and treatment can, it can literally break the bank. And we're going to talk a little bit more about how to look for insurance in just a few moments. Choose accommodations that suit you and suit your disease. Now, some of our patients are in really great shape, so they would be fine staying in a hostel and sharing the bathroom with, 10 other people. Other folks really need a little more time, and they really would do better not sharing a bathroom. So make sure that you have a good sense of what your accommodations are, what your privacy issues are, and if they match up to where you're going to stay. If you're traveling by bus, some buses don't have bathrooms, and that can be a real problem if you're between points in Wyoming, which can be a long ways between stops. When you're flying, request an aisle seat closer to the bathroom, and hopefully you all have the cards that we can get from the Crohn's and Colitis Foundation when you're a member or when your patients join the I Can't Wait. And that can be really, really helpful when they're getting on a plane or when they're checking in, speaking to the gate agent and saying, I need a seat close to the bathroom. And most people in the world are good. And so if they really understand what your issue is, they're going to let you have the seat in the bathroom instead of the, window seat in the middle of the plane with, 3 seats in a row. So you encourage your patients to have those cards and to use them. Also, encourage your patients to wash their hands really frequently. Carry the little bottles of Purell or hand sanitizer. They can clip on your backpack. They can clip on your purse to continually wash their hands. They touch something looking, at a market in, where are we going to go now? Let's do a market in, where should we go? Market in, let's go to France. We're in an outdoor market in France, and you're looking over all these things. You're touching things, which everybody else has touched. And then you've got an itch in your eye or scratching something, and pretty soon you're spreading more germs. A travel kit. And I had a patient of mine that used to make these, and she'd give them to other people. You can use like a fold-up cosmetic bag. I find that it's probably easier for women because there are clothes fold up, tighter than some of the men's do. But carry wet wipes, carry some toilet tissue, antibacterial hand soap, a change of underwear, and a change of slacks. Use a thin pair of sweats that they would roll up easy. The potpourri is really, really helpful if you're traveling on a bus, traveling with a lot of people, can kind of help keep your dignity about you. Some sanitary pads that can help if you're having any leakage, if you've got a fistula. Again, it's like the old Girl Scout or Boy Scout motto, be prepared. You can get little packets of electrolyte solution. So if you do have some diarrhea, you can make yourself up an electrolyte solution. They're small, they don't take up much room. Tylenol and some Ziploc bags, because sometimes you don't have some place to dispose of your wet wipes and your toilet tissue or your underwear that you just want to get rid of. I don't want to take it home, I just want to get rid of. So the Ziploc bags are really very, very helpful. And again, it's like your car insurance. You don't think you're going to back into that pillar across the street when you back out of the parking garage, but that's why you have insurance. And so that's what the travel kit is. It's your insurance, your peace of mind. Should anything go wrong, you've got something there to cover you. Vaccinations. So several of our speakers have touched on different vaccinations. Encourage your families to visit a travel clinic. Some of the local drugstores actually have travel clinics. I saw that Fred Meyer's in Everett said that they have travel clinics on a couple different days of the month. The UW has a travel clinic. So that's where they can get their baseline immunizations and get information. The CDC website is a fountain of information because the recommendations for different countries can change according to what happens to be the prevalent bacteria, viruses in the area. So the CDC will tell you, you don't need to have yellow fever vaccine for this part of Africa, but you do for this part of Africa. So it's really helpful to know that before you make your travel plans. Patients on immunomodulators, steroids, or biologics should not get, everybody should know this by now, our third lecture of it, the live vaccines. Live vaccines contain a version of the living bacteria that it has been weakened, but it can still cause you to get the disease. The most common live vaccine for travel is yellow fever. Occasionally you'll have a family talk about, they'll come and they're diagnosed, and you'll hear them talk about, I always go to this part of the country. So not only get caught up on their regular vaccines, but see if there's travel vaccines that they can get that will last for a time before they go on treatments that would make that prohibited. If the country that you're traveling to requires a vaccination, and that would be on the CDC website, you can request a letter from your doctor outlining that you're not able to take that particular vaccine and you're waiving any responsibility. But you can get that. So it doesn't mean you can't go, but you need to be a little more careful, and you need to kind of dot your I's and cross your T's. Where are you staying? Are you staying in an open air cottage? Are you staying, again, in a resort? There's a higher risk of disease in rural areas, and also if you're backpacking. If you're backpacking, who knows what bugs and things and the size of mosquitoes and things that you'll encounter as you're backpacking across Europe or Peru or other locations. So consider the areas that you're traveling in. So just a list that we talked about before about your live vaccines. Luckily, most people, unless their families have chosen not to do vaccinations, most of those are done before our kids are ever diagnosed with IBD, and then so when we pass them on to our adult colleagues, they've already been vaccinated. Traveler's diarrhea. So as I mentioned before, if you're traveling abroad, use bottled water. Avoid ice cream, ice cubes, uncooked foods, and you have to resist the yummy looking foods and the smells and the beautiful fruits that are on the carts of the street vendors. There's no guarantee on how it's washed, how it's stored, so you really need to tell your patients that they need to avoid those. It also includes coffee and tea not made, excuse me, with bottled water. Resorts in developed countries should be safe, and we tell our families they can use the water from the hotel because that's tested and is safer. Take the packets of electrolyte solution to mix with the bottled water, and caution your patients not to stock up on Pepto-Bismol and Imodium and those kind of things to take if they develop diarrhea. Have them make a plan with you before they leave. If you have diarrhea for this many days, start this antibiotic that I'm going to give you the prescription for. And most gastroenterologists, if you're going to do a significant travel, especially outside of the United States, will give a prescription of ciprofloxacin, metronidazole, or rifaximin in case of the diarrhea that lasts more than 2 or 3 days. Traveling with medications, we mentioned the original bottles. This is something I found out actually as I was getting ready for this talk. In Japan and Saudi Arabia, traveling with benzodiazepines, prescription sleep meds, or narcotics requires a special certification. And you can get that on the internet. And there are some meds, Humira can be out of the refrigerator for 2 weeks, but some of the other injectables can't. So here's what you need to have your families do. Get a Ziploc bag. Put the injectable medication inside the Ziploc bag and seal it. Get another Ziploc bag, fill it full of ice, put your med with the bag in it in that bag and zip it. When they get through or get to customs or the TSA, dump out the water that the ice is melted into. Then once you get through security, just go to one of the restrooms or restaurants and ask them, excuse me, to fill it up for them again. The flight attendants will be happy to refill it as you're flying. Just make sure that you have a refrigerator wherever you're going to stay when you get there. Travel insurance, read the policy carefully. A lot of policies exclude pre-existing conditions. In fact, I just booked a cruise. Thinking about this talk, I thought I have to book something fun. When you look at the travel insurance, it will say if you pay, at the time of your booking, pre-existing conditions are waived, as I was reading through. But if you purchase it later, then there's a significant waiting period. So you want to make sure that your condition is covered, and you often can buy a waiver for a pre-existing condition. Encourage people, this is all of us, when you're on a plane, get up and walk. Stretch your legs, contract your feet, but keep that circulation going. If your patients are going to fly a long distance, they're going to fly overseas, then encourage them to wear compression stockings. You can order really cute ones that don't look like old lady stockings. Write down a few phrases in the language that you're going to be in the country. So to ask, you can say, in German or in French or Spanish, where's the bathroom? Where's the hotel? Those basic ones. And I actually tried to get this up on my phone because I thought how fun it'd be to end with something talking to you in a foreign language, but I couldn't make it work. But there is an app on the phone that my daughter was able to do that's called Translate Google, and then you say or type in what you want, and it'll just repeat back in the language what you're saying. So that also would be really, really helpful. So in summary, patients don't know what they don't know. So hopefully you know a little bit more than you did when you first arrived this afternoon, and ask your patients about their travel plans and show them where the resources are so they can have a great time. With adequate preparation, there should be no reason why our patients with IBD can't enjoy all the travel and all the experiences that all of the rest of us want to have. Those are more patients. Let's see, we have a semester in Ireland, climbing Whistler, Ghana, and Peru. So again, do what you want to do so you can do what you have to do so you can do what you want to do. Thank you.